Let's start with an important grave definition. Self-medication with antibiotics, also known as SMA, was defined as the use of antibiotics by individuals to treat symptoms/diseases without professional advice, prescriptions, or medical supervision. According to Rang Zhu and others in their 2019 article, Self-Medication with Antibiotics Among University Students in LMIC, a systemic review and meta-analysis. Doing so can compromise your health and the health of others. Maybe you have been guilty of it or know someone who has taken antibiotics that aren't prescribed. Maybe you have or know someone who has bought antibiotics in Wadis without a prescription. It's very common and very unsafe. Yes, they help you feel better when you're sick, but what about when you are prescribed antibiotics? The dose and antibiotic type might not be beneficial to you at all. I work in a laboratory and know firsthand about antibiotic resistance and that pre-op patients have to be tested for the deadly and highly contagious MRSA. 2 sterile swabs are used to collect the specimens, one for each nostril, because the nose is where they colonize and are found in abundance. These swabs are then plated to see if MRSA is present. It is a crucial precaution the hospital takes to keep MRSA infections from becoming nosocomial. Let's do our part in preventing antibiotic resistance and never self-medicate with antibiotics. Today we will learn about antibiotics without prescriptions and statistics between adult Hispanic consumers and adult consumers of antibiotics. Then we will discuss the danger of self-medicating with antibiotics and how it contributes to bacteria becoming resistant, causing a higher risk of morbidity and mortality, states Zhu and others. First, let's discuss antibiotics and adult consumers. Self-medicating with antibiotics and attitudes about taking antibiotics have become an important health problem worldwide. Nowadays, antibiotics without a script can easily be obtained and are available a few different ways. Wadis offers just about everything the pharmacy in the States does, and you never need a script. Sometimes when you get a script, you take the antibiotics and stop when you feel better. For our last source of antibiotics, let's not forget friends and family who share because they care. Studies suggest that Hispanic consumers might differ from non-Hispanic consumers in their knowledge and attitudes regarding antibiotic use. According to Dr. Louise K. Francois Watkins and others in their article, Knowledge and Attitudes Regarding Antibiotic Use Among Adult Consumers, Adult Hispanic Consumers, and Healthcare Providers, United States, 2012 to 2013. According to the results, adult Hispanic consumers versus adult consumers were the most likely to believe if they have a cold, antibiotics would help them get better quicker. 48% versus 25%. They were more likely to get antibiotics not prescribed but left over from a previous illness. 25% versus 9%. They were also more likely to get them from a family member or friend. 17% versus 6%. Antibiotics are hardly indicated for a cough or cold, but 41% of Hispanic consumers reported expecting an antibiotic for these symptoms. The Hispanic consumers knew less of the potential dangers of self-medicating with antibiotics. One danger is the antibiotics becoming less effective after they are used. The other danger is the antibiotics might kill the normal flora that the body needs to remain healthy. After the study was analyzed, it was concluded that public health initiatives should target Hispanic consumers about the proper use of antibiotics. Now we'll discuss antibiotic resistance and preventive measures we can take to improve the situation. When you don't finish your antibiotics or self-medicate with antibiotics, you are breeding bacteria that will have evolved into antibiotic-resistant bacteria, causing untreatable infections to be deadly. The problems of antibiotic resistance become apparent within a few years of the introduction of antibiotic therapy, according to Sandra Aldridge in her book, Magic Molecules: How Drugs Work. At present, There is one antibiotic that can help fight MRSA. Its name is vancomycin. It's often called the antibiotic of last resort and has many side effects. Bacteria become resistant to antibiotics in 3 different ways. First, the bacteria can produce enzymes that break down the antibiotic. The second way is the resistant microbes stop the antibiotic from getting inside their cells or even pump it out once it is in the cell. The third way is the bacteria can alter the molecular target of the antibiotic, rendering any antibiotic useless. Besides antibiotic resistance, there are other grave consequences of self-medicating with antibiotics. It is possible that your true symptoms will be masked, making it difficult to get diagnosed correctly. There can be treatment failure anytime an antibiotic therapy is not adhered to. Lastly, there can be adverse drug effects or even death. A review reported that current deaths attributable to antimicrobial resistance every year is 700,000, a low estimate, states Rang Zhu and others. The number is expected to rise to 10 million by 2050, states Rang Zhu and others. The smart use of antibiotics is the key to controlling the spread of resistance, according to Howard Lewine in his 2019 article, Antibiotic-Resistant Superbugs. Based on studies done in 2019, it turns out that most cases of bronchitis, sore throat, ear and sinus infections will heal on their own. Antibiotics should only be prescribed when symptoms don't improve on their own and a bacterial infection is supposed to be causing the problem. MRSA and other resistant bacteria can be prevented. The easiest and best prevention is hand washing with soap and water. Pay attention to small cuts or breaks in the skin, and if you develop redness, swelling, and pain, seek medical treatment. When visiting a person in a hospital or nursing home, wash your hands before and after, and always follow patient contact precautions. When you're sick due to a bacterial infection, ask your doctor if you will recover without taking antibiotics. I'd like to urge all of you to never self-medicate with antibiotics and to take preventive cautions when antibiotics are prescribed. It is a dangerously thin line between antibiotics helping us or harming us. The control of antibiotic resistance requires that we address the determinants of infectious disease transmission as well as the provisions of antibiotics, according to Michael Millar in his article, Can Antibiotic Use Be Both Just and Sustainable or Only More or Less So? Today we've covered a number of topics related to self-medicating with antibiotics and antibiotic resistance. We discussed antibiotics without scripts and where they are obtained, the dangers of self-medicating with antibiotics, and what we can do to change. There was a study done on adult consumers and their attitudes about antibiotics with surprising results. Lastly, we learned about antibiotic resistance and what we can do to help with this public health problem. Let's do our part in preventing antibiotic resistance and never self-medicate with antibiotics. Remember, we must also take into account what will happen in the future. Our responsibilities to ensure that future generations have access to effective treatments for infection requires that we take steps to conserve the functions of antibiotics while not prejudicing outcomes for patients at present. Thank you.